Elisa, thank you so much for your contribution. We're going to miss you. I look up to you so much, and please accept this gift, and another round of applause from everybody else.
What to say except thank you and appreciation. I decided not to prepare remarks because I really just wanted to be present with you all and to put my 2 feet on the floor and really feel this moment. Our family moved to Santa Cruz before I started this job, just 6 months before, and we really knew this was the place for us. And we always try to get other people to move here. So we're not leaving, and I just want to start with that. Still very much committed to this community, remaining on a number of boards here, and hoping to make ongoing connections and continue to move the work forward. I wanted to share with anyone who may not know where I'm headed to the San Francisco Foundation. We'll be working on housing, which is clearly at a crisis point across the Bay Area, including in Santa Cruz, and really planning on bringing that knowledge and that regional momentum back home here, where we have those problems to really address, and to, I think what we all can agree on, and what I've really been talking about in some of my early meetings in my new job, is how these are human rights, healthcare, housing, and I know everybody who's here is working towards having that be available to everyone. And I'm just so committed to continuing to do that with the spirit and with this momentum that I've built up in this community. And I couldn't have done anything that I have done without everyone in this room, with folks who I met early on, who supported me in my work, the staff, as I mentioned, we've grown and become, I think, a lot more representative of the community that we're serving in. That's been such an important initiative for me, is for our healthcare community to look like the people that we serve, and I know we're all working towards that, and that's part of what we're here to talk about today. And I want to talk about the future. Really appreciate, look back on the past, but I so much look forward to building a future with you all in community and in service to these human rights that we all want for everyone. So thank you. A big hug to everyone here in the room. Please pass it on. Please tell your friends and colleagues how much I've appreciated working with all of them, and hopefully see you soon. It's now my great honor to hand over the mic to HIP's Interim Executive Director, Maritza Lara Villajota. Very proud of Maritza and her leadership at HIP, 5 years now under her belt, helping me build this organization, and I'm excited to see where she takes it.
I will probably say now we need to take another breath. So thank you for the reminder for mindfulness. Thank you, Elisa, for being here. I really hope you have taken the message on this video as a reminder of just how lucky we are that you said yes to HIP 7 years ago. The forum theme this year, Growing Your Own, really aligns perfectly with your leadership practices. I don't know if you knew, but I came to HIP 5 years ago searching for an unpaid internship. And Elisa saw beyond that, and instead of just becoming an employer, she also became a mentor. I know that for many of us here at HIP, we have been inspired by you, and we will miss you. I know that many of us are here because we care about workforce development, we care about mentorship, we care about growing our own. And I would like to start by thanking the people that have made this event possible. First, thank you to our sponsor, the Santa Cruz County Workforce Development Board, for sponsoring this year's annual community forum. Andy Stone, I would love for you to be acknowledged. The director of the Workforce Development Board is here with us today, and he's been such a champion for healthcare investment in our community. Can we clap? Give him a round of applause. And he's over there in case you don't see him. Thank you, Andy, for being here. I would also like to acknowledge the HIPS forum planning team. They have made today possible. Could you please stand to be acknowledged, my coworkers who have made today possible? Thank you. It is now my honor to pass the mic to my fabulous coworker, Hayley Mear. She serves as HIPS Workforce Development Manager, and she will share with us the work currently underway through the Health Workforce Council, and she will also introduce our speakers. I'll be right back. You're not done with me. Just a couple more moments.
Thank you, Maritza. Okay, well, thank you for joining us today. For those who don't know me, my name is Hayley Mear, and I am the Workforce Development Program Manager at HIP. I guess I'm doing my own slides here, so there we go. So at the beginning of this year, we interviewed 21 organizations across the county to learn about their health workforce challenges and needs. From this, we produced our report, Health Workforce Listening Tour in Santa Cruz County, Findings and Recommendations for the Santa Cruz County Health Workforce Council. You can view this report on our website, and the URL is listed on the slide above me here. I don't think anyone's really read it, so please take a look at it. Except for me and Maria, who did hours of editing on it. I'm thrilled to share 2 outcomes from our listening tour that are already underway. In a joint effort with Hospice of Santa Cruz, PVUSD's Watsonville-Aptos Santa Cruz Adult Education is awaiting approval from the California Department of Public Health to launch a home health aid certificate program that will be open for enrollment at the beginning of next year. With a connection made by HIP, Hospice of Santa Cruz assisted by identifying instructors to teach at the adult school, filling the gap in their program needs. Another exciting program in development with HIP serving as an intermediary, Dante's Community Dental Care is pursuing a registered apprenticeship program in dental assisting. We'll get a chance to hear more about that this afternoon. These 2 endeavors were originally expressed as challenges during our listening tour, and now we are seeing viable solutions emerge. And this was before we even launched the Health Workforce Council in June. In addition to the council, we currently have 4 work groups established in the following areas: behavioral health and health social workers, community health workers, medical assistants, and nurses. I'm pleased to share updates on our workforce progress this year, and remember our work groups just started only 2 months ago, although some developments started earlier, such as our efforts for community health workers. And I just realized this is like probably right in front of my face. So maybe down or over. Or we'll leave it there. I'll just stand to the side. So HIP worked in partnership with organizations across Monterey Bay on a grant application for the Health Resources and Services Administration Community Health Worker Training Program. It was submitted by the Monterey County Health Department this June. The awards will be announced on September 15th. So that's tomorrow. So applying was a huge accomplishment in collaboration across organizations, and I want to congratulate everybody who was involved in applying for that federal grant. I'm really hopeful that we'll receive good news tomorrow. Additionally, our behavioral health work group applied for the California Department of Healthcare Access and Information Health Professions Career Opportunity Program grant last month to fund post-undergraduate fellowships for underrepresented students. I just found out awards will be announced on September 20th, so if awarded, an announcement will be made at our next quarterly Health Workforce Council meeting on September 28th. Our medical assistant work group just met this morning, and we will be co-hosting Cabrillo College's Career Technical Education Advisory Committee meeting for medical assistants on October 12th at 10 a.m. If you are interested in participating in this online event, please connect with me or Ashlyn James, Ashlyn's over there, who is championing our medical assistant work group. Employer input is a valuable asset to curriculum and program development, and employer representation is greatly appreciated. So please do connect with us if you're interested in participating. Our nurse work group was recently established with 2 champions from Dignity Health and Cabrillo College. HIP's work group champions are people who are dedicated to fostering solutions to health workforce challenges on behalf of our community. We're seeking champions and participants to join the implementation of a physician's work group and our technician's work group. So if you're interested in getting involved with HIP in this important work, please don't hesitate to contact me. At this time, I'd like to thank everyone who has supported HIP's new workforce development program. If you participated in our listening tour, the grant applications, any of the work groups, or your name is Andy Stone, please stand for a moment so we can acknowledge the time and commitment that you've dedicated to cultivating health workforce development in our region. And let's give a round of applause. Maria, stand up too. Some of our HIP team, Maritza, stand up as well. Paola, Rita, you guys are here, you participated in our listening tour. Please stand up. Thank you all. Okay, so if you arrived late, by now you can tell the theme of today's event is focused on health workforce. And it is my pleasure to introduce our keynote speaker, Ton-Quinlivan. Vaughn is the CEO of Futuro Health, a nonprofit on a mission to improve the health and wealth of communities by growing the largest network of allied healthcare workers in the nation. She's also an appointee of Governor Newsom to the Health Workforce Education and Training Council, and she is a podcast host and author of the bestseller book, WorkforceRx, Inclusive and Agile Strategies for Employers, Educators, and Workers During Unsettled Times, which you can find at your table as in the centerpiece. So stay tuned for a raffle at the end of the event to win one of Vaughn's books. Please join me in welcoming Vaughn to the stage.
All right, while Hayley's flipping the slides backwards, I'm so delighted to be here. Isn't it exciting to be in person? Yes. So Elisa, congratulations on your next phase. Maritza, thank you very much. And Hayley and Maya, thank you very much for having me. Super delighted to come here and talk on this topic. As a little bit of background, my workforce development expertise actually spanned the private sector, then the public sector, and now the nonprofit sector. So when I was in the private sector, I worked for a company of 20,000 men and women in the energy industry, where we were facing 25 to 50% of the workforce on the verge of retirement over the ensuing decade. And so we had to put into place some very intentional workforce development strategies. And then I was appointed by Governor Brown to be Executive Vice Chancellor of the California Community College System. And I know we have a lot of colleagues here in the back. Say hello from community colleges or even our UC and CSU brethren. So excellent. And now I have the fortune to work with in the nonprofit space. Let me just do my 30-second of commercial here because I want to appreciate my organization for sponsoring me for being here. So Futuro Health was founded by Kaiser Permanente to benefit the whole industry, not to just grow allied health worker for itself, but to really benefit the whole industry, including Dignity and Sutter, FQHCs, etc. So we're always looking for partnership. We have a fantastic partnership with UC Berkeley, the Cal States, the community colleges, community organization, workforce boards. We really work together in partnership to grow the workforce. And I'm going to share a little bit about not only the principles that are laid out, the frameworks, the solutions framework that are laid out in the book, but how do then we combine all of these best practices for healthcare. And with Futuro Health, where we have focused has been how do you engage the diverse adult workforce to bring them into the right credentials so that they can break into healthcare and then move up. So what we're going to do is we're going to talk about the concepts and then we're going to apply them specific to healthcare. So next page. So I know that in California, we have a gap of 500,000 allied health workers. For those of you less familiar with allied health, imagine if you were out driving your Uber or in an Uber and you got into a car accident. Everybody from the paramedic that comes up in the ambulance to the medical assistants who checks you in, all the techs that touch you while you're in your hospital experience. There's so many wonderful jobs. 65% of the jobs in the healthcare world comprise these allied health roles. And many of them can be trained at the less than a 2-year degree, like an industry value certificate, as well as more advanced, full degrees. So I know that the issue that California faces is not alone. I was a part of the National Governors Association launch of the Healthcare Workforce Collaborative, where all these states were coming together, all the policymakers were coming together, struggling with all these exact same issues that I've listed here, that were articulated by 3 different forums of CEOs and COOs of health systems. It was one in DC, one in New York, and one in Orange County, where they laid out these common themes that are plaguing the healthcare workforce. Right, so we have retention issues made worse by the pandemic. There are cost challenges troubling the workforce. There's nothing that riles up these healthcare executives more than saying the word travelers. If you say the word travelers, they would get very upset because they're paying 3 times for the traveling workforce, the temporary workforce, than before. And so that has serious implications in terms of the financials. Retention is very difficult in this moment in time, and and all of the good news is also that all of these healthcare employers really care about infusing diversity and inclusion into the workforce, because it's very important for the healthcare outcomes that the workforce reflects the community that is served. So let me go through some of the principles laid out in the book. And the first is this solutions framework. And what's significant about this solutions framework is that no one party has to do this work alone. And so for many employers, they naturally, especially healthcare employers, they tend to think, oh, I have to do it on my own. The good news is that there are others that can come together to help solve. There are 3 parties: the employers, the workforce board, and there you go, the workforce boards and community-based organizations, and then the set of education providers. And each does what they do best and come together in order to create a solution. So let's talk first about the employers. What is the role of employers, and what are their contributions to this solutions framework? Well, employers, it's very helpful for employers to take the lead and inform, shape the work. It's really important for the employers to define the hiring needs and then to be able to hire against it. But the last check mark is really the most crucial and almost the hardest to do, which is it's so important to form a consortia in order to aggregate jobs. Now let me say that again, form a consortia to aggregate jobs. And why would you want to do this? And it's because we actually need to fix a problem I call in chapter 1, it's making the fire hose and the garden hose work together. All right, so those of you who are in education, what happens when you have a class of 25 seats, right? Okay, now it's, oh no, enrollment's 15, oh no, enrollment's 10. Your faculty is freaking out because their class is going to get canceled, right? So there's an economy of scale in education where you have to fill up a course, and if it's not to a certain volume, it's going to get canceled. Well, what happens when all those students begin to move through? Well, they all move through, maybe in May, they gush out into the economy. 25 of them graduate at the same time. How do employers rip out jobs for those graduates? Well, here's 1, here's 2, here's 3. It's like a garden hose. So what we're trying to fix here is how to bring the garden hose and the fire hose together. And if you can begin to aggregate, because you're forming consortiums of employers and pooling jobs, then you're able to aggregate the job so that the garden hose and the fire hose better match, right? And it becomes more interesting for higher education to be responsive with the curriculum, be responsive in terms of being able to set up more start dates and end dates. So forming a consortia can include working across multiple divisions, like in the dignities of the world, there are so many divisions. Your supply chain, there may be subsidiaries that contribute to your world that hire very similar occupations, right? Maybe the subacute centers, for example, is part of your supply chain, and they would have a lot of medical assistants, for example. Adjacent industries may hire the same things, and then competitors. Now this is really hard to hear. Well, competitors, are we really going to play together on our workforce? Especially in allied health, when you're working to bring large volumes of the community into these roles, it's easier to actually play together. And then the rule of thumb is we collaborate in order to develop the talent pool, because none of us want a talent puddle, right? We're going to collaborate to create the talent pool, and we're going to compete at the point of hiring. And this playbook actually proved out for the energy industry, where all the competitors came together to start setting up, working with education to set up curriculum, to even help with teaching, to help with facilities, whatever was needed to be a good partner to education, and then competed at the point of hiring. Education, what is the role of education? The role of education for this, and again, not every education institution is interested in this, but for those that are interested in workforce, the key role is to close the gap between where the population is and what is needed by the workforce. So when I was in the energy industry, what we found was that many of the candidates were failing the pre-employment tests in the area of spatial reasoning. So that needed to be, that was part of the curriculum in addition to the fundamentals of electricity. A lot of candidates were not actually in shape to pass the physical component of what was required for the pre-employment exam. And so the community colleges actually put in place a physical conditioning where students were not only doing the calisthenics but playing soccer every day in order to improve their physical strength. So again, designing the education to close the gap. And fortunately, these days we have so many options. The 2-year system, the 4-year system, we have online platforms, we have employer training options. So many things can be unbundled and rebundled together. And let me touch for a moment on some of the different ways that they come together, because it can be a confusing array of activities out there in education. So most of us know the degree because most of us grew up with really one unit of education, which was the degree, right? The associates, the bachelors, the masters, the PhD, the MD, etc. But now, because of the challenges in the workforce, where the shelf life of skills is so short, what the pressure is, how do you begin to modularize education so that people can keep up with the pace of change? And so there's a body of work that's being done by a lot of workforce and education stakeholders just to really show how things build upon each other. So on the left side, you start with competencies. Those competencies can be added up in different ways to create courses or modules. They can then be digitally badged. They can be then created, embedded into certificates, and then certificates can be embedded into degrees. So you can see how they begin to stack together. And so this is, you're beginning to see how credentials are created in order to just keep relevant, to bring relevance to the skill sets of students and workers. So I'm going to practice with you, and there's nothing more fun than to play with Legos. So I'm going to practice with you what we actually did, and this was very helpful to Damien here. So as you know, industry, especially in the tech industry, that area moves super fast, right? So Google made the investment to create the Google IT certificate. So if you do a Google IT certificate, you can come out and be a computer help desk individual, for example. So we looked at this and we said, okay, that's great. You have a Google IT certification, the middle blue square. But our experts looked at it and said, well, that's really quite not enough. We actually need someone to understand how that IT skill is applied in the healthcare context. So then we worked with Johns Hopkins to create a course that overviewed IT within the context of healthcare, because as you know, the privacy needs are different. There's, you know, the big hospitals and the clinics, and there's so many different environments, and then the stakeholders are the difference, right? It's the doctors and the patients, and, you know, so many different other stakeholders are involved. So Johns Hopkins created a different certificate. So now you have Google IT, then you have the Johns Hopkins. The third area that was missing was, because of these roles, you have the soft skills, right? The customer-facing skills. So then we had to add that component called human touch healthcare. And then especially with the population that we're working with, who are 80% diverse and may not have necessarily had a spectacular experience with education, higher education previously. As you know, you have to couple it with a lot of support. So live student navigators, career counseling, there's even a data science infrastructure, and then tuition subsidies. So this individual, Damien, went through this bundle of coursework, and then he landed in a call center, a medical call center. Just to give you an idea of the soft skills, we had to go, especially with adults, we had to develop a set of 6 digital badges, again, applying some of the framework. And so here are 6 essential skills, none of which is taught through lectures, no PowerPoints, is very experiential for the adult students, in order to ramp them back into education. And what we're also finding, especially since our K-12 population is flatlining or shrinking, and the baby boomers, the highly experienced baby boomers are exiting, you know, the action is really to figure out how to bring adults into the credentials that you need in order to grow the workforce. So these are more the non-traditional students. All right, so let's talk about what happens for someone who gets inspired because they tried the first bundle that I shared, and now they want to move on. So here we have the story of Nam, who, by the way, Strata Education puts out data that at this moment in time, adults are not in the mood to get a degree. It's too much of a commitment, but they're willing to skill. So how do you tiptoe them into a credential, like an industry valued credential? And then if they fall in love with it, the career path, then they'll go on. And so this is the story of Nam, who did the Google IT bundle that I shared previously, loved it. He had been laid off in the first year of that pandemic, right? He was told, hey, check this out. He checked this out and then fell in love with this field, and then went on to pursue a bachelor in cybersecurity. At the end of that year, had about 17 industry valued credentials that he earned as part of the bachelor. Got 4 job offers, 2 of which were over 80K. So that's an individual who have sat on the sideline, but now you'll be able to transition him in. And that's using an industry valued credential as a way to on-ramp him back into education. Now, we all know that the pandemic has an after effect, which is a secondary pandemic in mental and behavioral health. I saw that on your slide as well. This is happening across the state. So the shortages are all up at the master's level here, right? Which is a very, very far distance for communities to go. I know Kaiser Permanente has put out scholarships at the master's level. And so what's happening is people knock on Kaiser's door and say, well, I'm interested in the scholarship, but what is behavioral health, right? So what that means to me is that the pyramid is not primed. And so you want to be able to bring them in, bring people, the community in at different levels. So when we asked employers, we said, we know the shortage is at the master's level, but that's too far a distance. Where should we start? And they said, the 19 employers said, start here at the community health worker, which I saw on HIP's list as well, but don't do a generic community health worker, do a community health worker with a behavioral health emphasis. right? So you're beginning to equip your community health worker who knows and is trusted by the community with some baseline skills to understand, alcohol abuse, substance abuse, low-grade depression, for example. And then there's another occupation that is now Medi-Cal reimbursed called the peer support specialist. So this is someone, if you have lived experience, like you were homeless, or you were food insecure, or you were foster youth, now you have the ability to provide peer support to others, like coaching to your peers. That experience is very valuable, and so now there's a set of training to allow you to move into that. So the more shortage that we have at the master's level, the more paraprofessionals that we have to augment. And the key in the education field is how do we stair-step these individuals, like, for example, who started in sub-baccalaureate, like certificates here? How do you move them into an AA in substance abuse, for example, counseling? How do you move them into bachelor in social work? And then how do you move them into, accelerated masters so that they can get into the therapy area? And if each level you then respect what the person brought from before, that is very helpful, because there's nothing that adults hate more than to start from scratch. So if you can honor some of the prior coursework so that someone has an advanced standing, that is really helpful to accelerate the workforce development. All right, I know that there are a lot of good nursing programs here. Again, there's stacks, that there's deep shortages in the nursing pathway, but you have to also look at where does it break down. We know where the employers love to have, everybody wants a seasoned nurses. There's not enough of them, and so we have a number of breakdown in the pipeline. So according to some studies that were shared at the State Council, the breakdowns are 1 in the brand new nurses. Nobody wants to hire brand new nurses. So we actually need employers to adopt preceptor training so that the first year nurses can get their training, get in the door, and persist. There's like a 50% drop-off rate, so we gotta work on that collectively. There's also specialties like ER, OR, psychiatric. So you take a nurse and then you add a specialty on there. And then once the pipeline starts moving, all the colleges can start kicking in with production at all the different levels. And so priming the pump on that is so important. All right, so I'm going to be closing out here. So we have been doing this work. We were launched in 2020 with the invitation, how do you combine all of these best practices that are laid out in order to solve the magnitude of this issue? We had the opportunity to actually become an accredited institution, which Kaiser Permanente has done as a playbook in the past. They launched a medical school, they launched a School of Allied Health. We decided that what we wanted was to be able to build a solution that can offer scale in terms of volume of students, that can still pay attention to diversity. We're able to keep the 80% diversity, diverse learners, and then also agile, because things are changing so fast, skill sets are changing so fast. How do you have an agile system? And so what we built was actually an ecosystem approach, right? Applying the principles of the book, an ecosystem of the willing. And so in order to deliver and launch each year it's been like 3 to 5 programs more. So in order to launch all 19 programs over the last few years, we actually have brought together 65 colleges and their campuses, each offering and doing what they do best. And then we're bringing enrollment in a big way to them, which as you know, many of the colleges right now are having a hard time with enrollment. So it's been a good partnership where we can work with the WIBs and the community-based organizations and send 88 sterile processing tech candidates, very diverse, into a college, of which 84 out of the 88 were accepted. So that's a real help to the college partners. So we continue to launch programs, continue to look for partners on the employer side, the education side, and the community side. And just to give you some insights into the data science that's behind that, some of our team members were behind some of the huge data sets of California, of Texas. And so even the recruiting aspect of how do you begin to recruit en masse for these programs, we're beginning to just rewire how we think of recruiting, because part of it is how do you bring adults who are reticent to participate in education back in so that they can be reskilled and redeployed for the healthcare workforce. So I haven't gotten the hook yet, but so I want to just also share, it was a real pleasure to do the pandemic work of putting down some of these best practices and what are the challenges and the solutions in this book. And thank you for sponsoring some of these books. The proceeds go to benefit the nonprofit work of Futuro Health. And for those of you who like podcasts, I have the fortune to be able to invite leaders and thinkers who are thinking about the future of work, the future of healthcare, the future of higher education, and get their provocations on a podcast. So this is available wherever you like to listen to podcasts. So with that, let me just close out, and if you don't give me the hook, I'm happy to take a question or two. All right, is there any questions? You're letting me off easy, but it's such a pleasure to spend time with you. Oh, one question right here. Go ahead.
Hi, my name is Carmen Powell, physician at Watsonville Community Hospital, pediatrician. One thing I just wanted to know is how do you address like income disparities and also just kind of the wealth gap, especially for communities of color? I know that doing a lot of these training programs is a cost financially, so I know you mentioned scholarships and things like that, but how do you address that, especially in lower income communities, and how do you kind of meet those needs?
Yes. So when we were approached by Kaiser Permanente to think about how do you design a solution, we did 4 focus groups, and including one in entirely Spanish. And what we found out was that there was a lesser awareness for all the different range of occupations. I mean, if you sit around the dinner table, you'll talk about doctors and nurses, but nobody talks about, hey, let's be a medical sonographer, right? I mean, so there's all these wonderful careers that communities don't know about. But the other more troubling issue is that many who managed to break into healthcare, they were so laden by debt and they were stuck at that first rung. So the good news at this moment in time is there's a huge amount of federal funds and even more state fund. There's $1.7 billion put into healthcare and more put into the mental health and behavioral health issues. And so there's a lot of money for workforce development. It always favors the organized, right? If you're organized, you're more likely to be able to be ready for these funds. And so I think that's why it's so important to have these forums, to have the organizers such as HIP, and to think about those 3 circles. How do you bring those 3 parties together so that each party does what it does best, but you're organized and all that fund will come through. So what we managed to do, because we had initial funding from Kaiser, was that for the 8,265 diverse adults, we were able to underwrite everybody's tuition into that first job with full scholarship. And it was the right thing to do over the pandemic. And then as people move up, they are able to move into better paying positions, and that's where I think you then begin to have partnerships with the employers who may have tuition reimbursement in addition to federal Pell monies, for example. So I think right now is a good moment in time to be organized so that the funding, you can attract that funding to serve the community and to get people into the workforce debt-free. Hayley.
Thank you so much, Vaughn. I don't know if you know, but we were so excited that you're here that we programmed a disco party light for you in the corner. I'm just kidding, it's broken, we can't fix it, so. Thank you so much for joining us today. Okay, next we have Abby Snay, the Deputy Secretary for the Future of Work at the California Labor and Workforce Development Agency. It's actually a great segue to what Vaughn was just mentioning, all the federal and state funding that's coming for, to fund healthcare workforce. And while Abby was unable to join us in person, she prepared a 15-minute video for us to view. So let's watch it now.